Welcome to the Self-Help Book Summary Vault, your sanctuary for personal growth and empowerment. Let's dive in.
Clinical Handbook of Coexisting Mental Health and Drug and Alcohol Problems Book Summary by Amanda Baker. This book dives into the complicated world where mental health issues and substance use problems overlap. It's a guide for professionals working with people facing both challenges at the same time. Right from the start, Amanda Baker makes it clear that treating these issues separately doesn't work well because they often feed into each other. The book begins by explaining what coexisting problems look like in real life. It describes how someone might struggle with depression or anxiety while also dealing with alcohol or drug misuse. This combination can make symptoms worse, and it's tricky to figure out which came first or how to treat them together. Baker then walks through different types of mental health disorders that often appear alongside substance use, like schizophrenia, bipolar disorder, and personality disorders. She explains how each condition can affect a person's behavior and why understanding these details helps tailor treatment plans. One important part covers assessment methods. The book shows how to gather information from patients carefully, considering both their mental health symptoms and their substance use patterns. It stresses the need for honesty and trust between the clinician and patient, since people might hide or downplay their problems out of shame or fear. Next, the handbook focuses on treatment approaches that combine therapies for mental health and addiction. For example, cognitive behavioral therapy is adapted to address both sets of issues at once. The book also highlights medication management, explaining when certain drugs can help or cause complications if not monitored closely. A key message is about teamwork. Baker emphasizes that successful care involves different professionals working together: psychiatrists, counselors, social workers, and sometimes family members too. This team approach helps cover all angles of a person's needs rather than treating parts in isolation. The book doesn't shy away from challenges either. It talks about common barriers like stigma around addiction and mental illness, limited resources in healthcare settings, and difficulties keeping patients engaged in long-term treatment plans. Baker offers practical ideas to overcome these hurdles, such as flexible appointment scheduling or peer support groups. In later chapters, there are case studies showing how these principles play out with real patients. One story follows a young woman battling post-traumatic stress disorder while struggling with opioid dependence. The case shows how combining trauma-focused therapy with addiction support helped her regain control over her life. Towards the end, Baker discusses prevention strategies aimed at reducing the risk of developing coexisting problems in vulnerable groups. This includes early intervention programs for teens showing signs of mental distress or risky substance use before things escalate. The final sections provide resources for clinicians, tools for ongoing learning, links to support networks, and advice on self-care to avoid burnout when working in such demanding fields. This handbook is packed with practical information for anyone involved in mental health or addiction services. It highlights that treating coexisting conditions requires patience, flexibility, and a clear understanding of how intertwined these problems are. If you want to support Amanda Baker's work and get a full picture of managing dual diagnosis cases professionally, picking up this book is a great step. Feel free to share your thoughts on this topic or recommend other helpful books in the comments below. Your input helps others find valuable resources too. By following the guidance here, clinicians can better help people caught between mental illness and substance misuse find paths toward recovery that address all parts of their experience together.
If you found this summary helpful, be sure to like and subscribe for more insights that will empower your journey.